Governor Hogan made an executive order to make Marylanders stay at home. How have you been personally with all that's been going on?
We've been fine, and thank you for asking. One of our 3 kids is at home with us. The other 2 are safely ensconced and quarantining elsewhere. Hey, in these days, if everybody is healthy, knock on wood, and we have enough food to eat, then we've got nothing to complain about. I've been spending a lot of my time trying to get citizens from the Maryland's, well, from all over Maryland, but primarily from Maryland's 8th District, my constituents, back from other countries where they've been stuck. A lot of people have been stuck in Peru. One of the women we've been trying to help, Sarah Herdman, knock on wood, is about to board an airplane, or maybe on an airplane soon, on her way from Cusco to Lima, Peru, and then from Lima to Miami, and then from Miami to Dulles, and then back home. So we've got our fingers crossed on that one, but my staff has been working like day and night to get people back from Peru, from Ecuador, from Kosovo, from Toronto, wherever they're stuck. When the president made his order about the border, it caused problems with Americans all over the world. And so we've been trying to get everybody back home. And then we've been trying to get the PPEs to our local hospitals and to the counties to make sure there are enough masks, there are enough gowns, there are enough ventilators for the patients, and then the PPEs for the doctors and nurses and healthcare providers who are really on the front lines of this crisis. So that's kind of how I've been spending my days. And we're starting, we passed, as you know, the CARES Act, and we're working on our next round of legislation. But I've had a series of town hall meetings, telephone town hall meetings, of course, to get the information out to the public about what we've done with respect to small business and unemployment insurance and paid sick leave and hospitals and so on. So a lot of it is just getting the word out about what's happening.
And yesterday, some of the biggest news to come out, President Trump and his task force announced that the best case scenario for the country was between 100,000 and 240,000 deaths. Today in Maryland, we're approaching 2,000 coronavirus cases. What's your reaction to these numbers? And as a country, is enough being done to tackle this public health crisis?
Well, it's a chilling and macabre situation we're in. We've already lost more people to this virus than we lost on 9/11. And the president who said it would magically disappear and we wouldn't lose anybody, and it was one guy from China and all this stuff, now is talking about 100 to 150,000 people, which is double the number of people we lost in the entire Vietnam War. And some projections go up over 1 million, 1.5 million, 2 million. So this is a nightmare and a catastrophe for our country that we have been brought this low. I think that the people have been very responsive when we've been able to give people clear directional orders about what to do. Governor Hogan has done an excellent job of encouraging people and now ordering people to stay home. People should only be leaving for the purposes of healthcare or getting food, or if they have necessary work, if they are working at a hospital or they are working at a grocery store. And these people are the heroes of the coronavirus crisis. These people are putting their lives on the line for us every single day. And the least that the rest of us can do is stay home when we don't have to be out. We've got to stay home. And if you got to go out, you got to put a mask on. I've worn a mask the last couple of days, and it gives you a much greater sense of security. And it also, I think, telegraphs to people the importance of everybody taking every measure possible. When I see people on TV at a beach frolicking in a big crowd, or in some parts of the country, people still out at a restaurant or a bar or something, I can't believe it, because we are so far beyond that at this point. And remember, it's a stealth virus because a quarter of the people who have it, the public health authorities tell us, are asymptomatic. So they don't know they've got it. So you just have to assume that anybody you're in contact with has got it and take the proper precautions. And it's not to promote paranoia, it's to promote a sense of self-preservation. And we've got to learn to be physically distant and take the physical distancing, but emotionally and spiritually connected and close to people.
Could you talk to me a little bit about the CARES Act that was passed by Congress? Could you give me a little Sparknotes summary of the CARES Act and maybe some of what Marylanders have been asking you about the CARES Act?
Yeah. I'll give you a bird's eye view of the whole thing, because there's a ton of stuff in there and a lot of stuff we can be really proud of. There's $150 billion for healthcare and for the hospitals and for the healthcare providers, so that we're getting the personal protective equipment to the frontline health providers, so that we're getting ventilators into the hospitals. And so we are getting the money into the hospital systems and the public health authorities we need in order to hire people and to pay people decent wages, so they don't just walk off the job because it's not worth it to them. There is in here $260 billion for the unemployment insurance system. This is really critical for people to know. We lost 3 million jobs in the first week of kind of lockdown precautions at the beginning of March. And we've lost, it must be over 10 million jobs now, but millions and millions of people are losing jobs at an unprecedented rate through no fault of their own. And I'm very proud that the unemployment insurance provisions that we put in will allow for people to receive benefits not at 40 or 50% of what they were earning, which was basically the average around the country, but 100% of what they're earning for the next 3 to 4 months, whatever it was your state was doing. You would be able to get essentially 100% because of an extra $600 a week that Congress put in. Now it'll be distributed through the states and through the state unemployment insurance system. It might be 2 checks or it might be 1 bigger check. It's up to the state, and Maryland has not yet announced whether people will be getting, 1 unemployment check from the state and then another just from the feds at the $600 a week, or it might be all combined. But in addition to that, we've added an extra 13 weeks to extend this whole payment, this whole nearing 100% payment for people. So this should take care of people, depending on your specific situation, for 6 to 9 months, depending on how long you've been working and so on and so forth. And the thing that I'm really proud about, and I'm hoping that this becomes an historic change within unemployment benefits, is it applies not just to people who are on a monthly salary, but people who are self-employed and file 1099s, independent contractors, consultants, people in the gig economy. All of these people will be able to collect unemployment benefits because they were working too, and they were being productive, and they were paying taxes. And just because they don't have a boss doesn't mean that they're not essentially thrown out of work by virtue of what's happened. So I'm very proud and impressed that we were able to get this done in the House of Representatives, and we had to fight with the Senate about it. There's been a difference in philosophy about the whole thing. I mean, the Democratic-controlled House has really fought for a bottom-up approach to this. We also fought for hundreds of millions of dollars for small business. And we are allowing for forgiveness of existing small business loans, the 7A loans, during this period. So people don't have to pay anything on existing loans. But more importantly, there's a $10,000 emergency grant that small businesses and not-for-profits can collect. And there's an additional loan available to businesses up to $10 million. Most small businesses won't be eligible for that much. It's determined by the size of your payroll. So it's 2.5 times what your monthly payroll is. So if you bring in and you show SBA you've got a payroll of $100,000 a month, you would be eligible for $250,000. So you'd be able to get $250,000 relatively easily, far more easily than you'd be able to get the general SBA loan, because Congress has wanted to get this money out into the small business sector, understanding what a crisis and what an emergency it is. So I'm very happy about what we've been able to do for small business and what we've been able to do for unemployment insurance, the money going into the healthcare system. You've probably heard that there will be a $1,200 check going to most Americans. If you earn $75,000 or less, you will get a $1,200 payment plus $500 for kids under the age of 18. If you earn over $75,000, you will get something. The money begins to decrease, going down to, I think it's at $112,500 where it stops. We assume that people are doing okay. Of course, if you make a good salary of $150,000 and you're thrown out of work, you can go immediately for the unemployment insurance. And again, you're going to receive something close to your complete salary during the course of this crisis for many months. So we've made a very serious investment befitting the catastrophic economic circumstances that follow from this public health nightmare that we're in. In the next round, I think we will know a lot more about the disease. We'll know a lot more about the treatment of the disease. We'll know a lot more about where we are on the vaccine and so on. But I think that we're going to have to get the very best public health authorities and scientific minds together and figure out a plan to have something close to universal testing in the population. There are new tests that are coming out, serology tests, blood tests that come back with a result in like 45 minutes, much more quickly. If we could somehow test everybody, figure out who's got it, quarantine those people, get them the help they need for the 2-week period, and then other people who've already had it and have built up the antibodies or who don't have it can take precautions with gloves and masks to begin to get back to work. But we need a methodical process for doing this. And I think everybody recognizes that the president and his team fell down for the first 2 months of this nightmare and basically provided no leadership at all. And it's been completely chaotic. And whatever leadership we've gotten has been at the state level from people like Governor Hogan, Governor Cuomo in New York, and the governors in California and Washington State and around the country. But somehow we are going to have to develop a national testing regime and protocol in order to get America back to work to get through this.
So it sounds like Congress is going to have to reconvene to do more legislative work. How, with social distancing efforts, how is this going to look, and how will Congress vote? Because that's a whole other issue on this.
Well, I'm really glad you raised that. We went back last Friday to vote for the CARES Act, and one of our colleagues, a Republican from Kentucky named Tom Massey, insisted on a quorum call, meaning that rather than proceeding by unanimous consent, which would have meant that 2 or 3 members could be present. And one of the things I've been doing is going down to be the Speaker pro tem and to preside, because I live just a half an hour away from the Capitol. But rather than just having a handful of people go down, we needed to have hundreds of people go down in order to establish the quorum, because Mr. Massey decided that he would turn this quorum call essentially into a game of Russian roulette. I think that it was probably unwise for us to go down without having masks on. I wish we had masks on when we did that. And next time, I think we will have masks. But hey, we've got a constitutional responsibility, and we've got a political responsibility to our constituents to go and to get the people's work done and to provide leadership for the country. And we're going to do it. But I think that we've got to begin to take every possible precaution, including masks and gloves, next time that we go down.
For some of the Americans who are out of work and who are, looking at those stimulus checks coming, and they see that it's just $1,200, Will there be more? Will there be more work to have those reoccurring for however long this goes on?
Well, I just sent a letter yesterday with a couple of my colleagues, Alexandria Ocasio-Cortez and Rashida Tlaib. We sent a letter to our colleagues proposing that the next package include another round of that stimulus payment to people. Obviously, if you're thrown out of work and your family has no other income coming in, then a $1,200 payment is only going to take you so far. So I think that, yes, that's very much on the agenda. We'll see. I mean, remember, there's a tug of war between the House and the Senate. We didn't talk about the part that the Senate really wanted, which was a $500 billion slush fund for the president to hand out to large corporations, to big businesses, with as few strings attached as possible. There was no way we were going to get this legislation through without them getting that, because that was just like we were committed to unemployment insurance and to the money going to small businesses and to the healthcare sector. They wanted this money to bail out the airline industry and the cruise industry and the hotels and so on, which isn't necessarily a bad idea as long as the purpose of it is to maintain the workforce and to help keep the businesses going and people employed. We don't want something like what took place in 2008 after the mortgage meltdown crisis, where this money went to corporate dividends and buybacks of stock from the shareholders and bloated bonuses for the CEOs and so on. So we were able to at least attach those restrictions. No corporate dividends could be paid for this way, no buybacks of stock, no bloated bonuses and so on. And we have an inspector general that we've appointed within the Treasury Department just to look at this, and then a congressional oversight panel. Already the president, in his signing statement, rather than talking about any of the other stuff, the unemployment insurance and the money to the hospitals and healthcare providers and PPEs, what he wanted to talk about was, in his signing statement, was that he said that Congress had overstepped its bounds and he did not accept that this oversight panel would report to Congress without going through him, and that he would be the one who would be doing the oversight over this money given away. We got an amendment attached which prevents any money going to any of the president's own businesses, as well as to any businesses belonging to a member of Congress. So that's good, but this is not ideal, and it's not the way we would have chosen to proceed, but this is bicameralism. We've got a House and we've got a Senate, and we've got different parties in control of each one, and we just have different public philosophies about the role of government, and those philosophies are in a glaring spotlight right now because of the crisis. The whole country's watching, the whole world is watching how we spend this money and what we do.
At your telephone town halls that you've been hosting, what are some of the most frequently raised concerns that you've been hearing from your constituents?
Well, what a nice question. I mean, we've divided our town halls up to different themes. So the first one was about public health. A lot of people were concerned just to get the basic information because there's been so much miscommunication and so much disinformation at the national level. And so they want to know, for example, is it, how is it you contract the disease? What do we know about that? Is it safe to be around family members? Is it safe to have people over to your house and so on? And we're, of course, telling people, no, you want to stay in your house with your family. And even there, if you don't know exactly the state of different family members, to keep your distance as much as possible and to keep separate utensils until it's clear that everybody doesn't have the coronavirus. So a lot of basic public health questions when we first started. In the next round, we had senior citizens talking about the crisis and what their needs were. One of the problems is that so much of the information available about the coronavirus and programmatic responses to it comes online. And a lot of the senior citizens are not online and they don't know how to use the internet and computer. So that's lots and lots of people. And in my district throughout Frederick County and Montgomery County and Carroll County, there are lots of seniors who basically feel themselves trapped in their homes and not understanding what's going on. So we were able to get them the telephone numbers of the county agencies that are dealing particularly with seniors, that are making it available to get groceries delivered to seniors when they have no other way to get them, and to make sure that they have access to their prescription drugs and so on. So we had a lot of questions like that from the seniors. My guest on that teleconference was Donna Shalala, who had been Secretary of HHS under President Clinton. And so she had a lot of interesting things to say about Medicare during this process, and Medicaid, and how they're working and how they might be available for people suffering from different kinds of problems. And the one that we did yesterday was really focused on small business and how small businesses can procure and access these loans to save themselves, the restaurants and the bars and the small shops and the stores that are suffering terribly under the weight of the crisis. And there is a lot of good news in there with the emergency grants, the $10,000 that people can get, which then counts against a loan that you can get, which is based on 2.5 times your monthly payroll salary table, right? So if if you've got $100,000 of salary payments you make on a monthly basis, you'd be able to get $250,000, 2.5 times that as a loan to see you through. And it's a forgivable loan. You will not be asked to pay it back so long as you keep your workforce intact and have them hired when the crisis is over. So we had a lot of specific questions about how those small business provisions work, and a lot of that's still being worked out. People shouldn't get freaked out if they don't know every detail yet. The SBA is still working on a specific policy guidance to answer a lot of the questions that people have. In our area, a lot of people have been asking whether 501c6s are eligible. 501c3s are eligible, charities and churches and small not-for-profits that serve people. But a lot of our questions were whether C6s, which are trade associations, are eligible for it. And we don't know the answer to that yet. We're waiting for the Treasury Department to come back with a guidance on that, along with the Small Business Association. We also talked about the unemployment insurance provisions and how the general policy directives that are built into the CARES Act are going to be translated at the local level. For example, we said that people don't have to make the general proof that they're out there interviewing for jobs and trying to get other jobs in order to get the unemployment compensation. One, because there are no jobs out there to be had, and two, because it's dangerous to go out and be doing this. And so we want to make sure that we're able to get unemployment insurance to people. Well, the old forms require you to certify that you are out and have made at least 3 job attempts through interviews and letters and so on. And we're waiting to hear back from the state unemployment insurance people about whether they're actually going to hold people to that during this process or not. So there's a few questions that remain to be answered. We're in excellent hands with the state unemployment insurance people, and they will be, issuing FAQs and general policy guidance on those questions now that it's gotten down to the state level.
And my last question is, I guess, when it comes to this coronavirus pandemic, what is keeping you up at night? What are some of your biggest concerns, or is there anything that you wish people understood more that people aren't getting right now?
Well, look, this is a $2 trillion bill that we just passed. I mean, it's probably the largest spending bill in American history. I haven't looked it up, but I have got to assume it's the largest spending bill in American history. But if you think about it, it's an absolute Band-Aid if we're not dealing with the health crisis. So the public health crisis is central, both because this is our families, this is our loved ones that are on the line, it's our people. And this crisis has reminded us what the purpose of government is. It's to secure the conditions of life and liberty and prosperity for our people. But life comes first, right? So we're, maybe we could afford another $2 trillion package, maybe even one after that. Not many more could we really afford. It's a tremendous amount of money. And all of it is a Band-Aid if we're not dealing with public health crisis. And that's obviously where I fault the president, as everybody else does, because he was in an absolute state of denial for 2 months about this. And that was dangerously reckless, and it's cost us precious time, and it's costing people's lives. So we need the real public health authorities, the scientists and the doctors, to be informing the federal government response. And we need a federal government response that's effective and efficient. I mean, I go on calls with hospital directors and states. All the states are competing with each other to get equipment. All the hospitals are competing with each other to get equipment. We don't have a national healthcare system. It's just dog eat dog out there. There are bidding wars going on for ventilators. It's like an auction. That is not a coherent way for the world's oldest and greatest democracy to operate. We can do a lot better than that. This is why we have a federal government. This is why we have a president of the United States. It's why we have a national government. It's to be an instrument of the common good and to pull us together across state lines to have coherent strategies for things that affect all the people. And the virus affects everybody in the country. And so we have been missing that national strategy. We've had some very impressive public policy performances at the state level by governors, including our own Governor Hogan and Governor Cuomo, of course, who has become kind of a rallying point for people around the country as to how effective government executives can work. That's what we're waiting for. And I want to make sure that in our next package, we have money to support a real plan that all parts of government will be working on together as a harmonious whole. Because this chaotic situation where states bid against each other and hospital systems are pitted against each other is not working for us in the middle of a crisis. And it's not befitting a country where people are committed to each other. I mean, I'm instituting a new feature on my website and social media on Friday called Local Heroes, about the extraordinary things that my constituents are doing in their communities. And it will blow your mind to see the kinds of things that people have put together at the local level to make sure that seniors get the meals that they need, that they're getting their prescription drugs, to volunteer to collect masks that are not being used by dentists and orthodontists and delivering them to the hospital. I mean, we are a people who love our country, and there's tremendous patriotism and community spirit out there. And it's the government that has let us down, not the people. The people are saving us from the recklessness and the dangerous ignorance of people at the top of our government today.